Hi, my name is Amber Terhune. I am the health educator for the Johnson County Health Department. In this presentation, I'm going to discuss strokes. A stroke is also called a brain attack or cerebral vascular accident or CVA. It is caused from the blood supply to the brain being blocked or from a blood vessel in the brain rupturing. The brain needs oxygen to survive. It uses approximately 20% of the oxygen that we breathe in. A loss of blood supply leads to tissue death within minutes. The brain controls movements, stores memories, sources of thoughts, emotions, and language, and controls body functions such as breathing. A stroke can cause lasting brain damage, long-term disability, or death. It is a medical emergency. Early action can reduce the damage and complications. Strokes are the fifth leading cause of death in the United States. It is also the leading cause of serious long-term disability. More than 140,000 people die each year, and the highest death rates are in the southeastern United States. About 795,000 people in the United States have strokes each year. This means that someone in the United States has a stroke every 40 seconds, and almost 1 in 4 of these are in people who have already had a previous stroke. About 80% of strokes are preventable through healthy lifestyle changes and managing risk factors with your healthcare team. Strokes can also be treatable. Ischemic strokes make up about 87% of all strokes. This is where the blood flow is being blocked to the brain. It is caused by blood clots or plaque that block the blood vessels, also called atherosclerosis. One form of an ischemic stroke is a thrombotic stroke. This is where the clot forms in the arteries that supply blood to the brain. This clot is called a thrombus. Another type of ischemic stroke is an embolic stroke. This is where the clot forms away from the brain, usually in the heart, and is carried through the bloodstream to lodge in narrower brain arteries. This kind of clot is called an embolus. Hemorrhagic strokes make up about 13% of all strokes. This is from a leaking or bursting of a blood vessel. Blood builds up and pressure damages the surrounding brain tissue. It is caused by high blood pressure, overtreatment with anticoagulants, or aneurysms, which are balloon-like bulges in the artery that can stretch and burst. Hemorrhagic strokes can also be caused by a rupture of arteriovenous malformations, or AVMs, which are abnormal tangles of thin-walled blood vessels that are present at birth. One type of hemorrhagic stroke is intracerebral, which is the most common hemorrhagic stroke. This is where an artery in the brain bursts and the blood surrounds the brain tissue. Another type of hemorrhagic stroke is subarachnoid. This is where an artery on or near the surface of the brain bursts. Then there is bleeding in the area between the brain and surrounding tissues. A transient ischemic attack, or TIA, is also known as a warning stroke or mini stroke. This is where the blood flow is blocked for a short period of time. The body may break up the clot, or the clot may get dislodged and travel elsewhere, causing no more symptoms. A TIA is a warning sign of a future stroke. As many as 17% of people have a major stroke within 3 months of a TIA. It is a medical emergency as there is no way to tell by the symptoms whether or not it is a true stroke. There is no permanent damage from a TIA. There are many risk factors for stroke. The chance of stroke doubles every 10 years after age 55, but it can happen to anyone. Women have a higher risk of stroke, but men have a higher risk at younger ages. Women are generally older when they have a stroke and are more likely to die. Women also have some risk from birth control use or hormone therapy replacement, pregnancy, and childbirth. The risk of first stroke is nearly twice as high for African Americans as it is for whites, and death due to stroke is highest among African Americans. Family history, including genetic disorders, common environments, and common lifestyle choices, also increase the risk. Tobacco use damages the heart and blood vessels. Nicotine raises blood pressure, and carbon monoxide reduces the amount of oxygen in blood. Secondhand smoke is also a risk. Drinking excessive alcohol can raise blood pressure and raise triglycerides, which can harden the arteries. Illicit drug use reduces blood flow and can cause arteries to narrow. Physical inactivity can lead to obesity, high blood pressure, high cholesterol, and diabetes, which are all risk factors for stroke. High cholesterol is also a risk factor as the extra cholesterol builds up in the arteries, including those in the brain, causing narrowing of the arteries. High blood pressure puts too much pressure on the arteries and can cause them to rupture. With diabetes, the sugars build up in the blood and prevent oxygen and nutrients from reaching the brain. Diabetes is commonly linked with high blood pressure. Having a previous stroke or TIA, or having aneurysms or AVMs that cause them, also increase your risk. Heart disease, including a buildup of plaque and heart defects, can cause blood clots that may break loose and travel to the brain. Other heart conditions, such as atrial fibrillation or heart failure, also increase the risk. Sickle cell disease is where the red blood cells are abnormally formed and they can get stuck in blood vessels and cause blockages. An unhealthy diet, such as high in saturated fats, trans fat, cholesterol, and salt, can cause heart disease, which is a risk factor. Obesity is linked to high cholesterol, high blood pressure, and diabetes. With obstructive sleep apnea, the oxygen level drops intermittently during sleep. Stress may increase blood pressure, and some medications, such as blood thinners or hormone therapy, can cause strokes as well. Here are some common symptoms of stroke. Remember, B fast. B stands for balance. They may have trouble walking, such as sudden dizziness, loss of balance, or loss of coordination. They may have a sudden severe headache with no known cause, which may be accompanied by vomiting, dizziness, or altered consciousness. E stands for eyes. They may have sudden trouble seeing in one or both eyes. It may have blurred or double vision. F stands for face. Have them smile and see if one side of the face droops. A stands for arms. Have them raise both arms and see if one arm drifts downward, or is one arm weak or numb. And they may have sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, or paralysis. S stands for speech. Have them repeat a simple phrase and see if the speech is slurred or strange. They may have sudden confusion, trouble speaking, or trouble understanding others. And T stands for time. If any of these signs are observed, call 911 immediately. Always be sure to call 911 if a stroke is suspected. Time is tissue. Every minute counts. Do not wait to see if your symptoms disappear. Do not drive yourself or have someone else drive you, as this only delays treatment. Emergency medical services can begin treatment immediately, and they may take you directly to a specialized stroke center. EMS can also collect and relay information to hospital staff prior to your arrival, which will further speed up your care. There are many different diagnostic tests that will be done if stroke is suspected. You will have a physical examination, including medical and family history. You will be asked when the symptoms started, what you were doing when the symptoms started, and if the symptoms are still present. This will also be done to rule out other possible conditions. Blood tests will be taken to see how fast the blood clots, to see if sugar is abnormally high or low, to check if critical blood chemicals are in or out of balance, and to test for possible infection. A computerized tomography scan, or CT, is a series of X-rays that create a detailed image of the brain. It can show hemorrhages, tumors, stroke, or other conditions. They may inject dye to view the blood vessels. Magnetic resonance imaging, or MRI, uses radio waves and magnets to create detailed views of the brain. It can detect brain tissue damage, and they may inject dye to view the blood vessels and blood flow. A carotid ultrasound uses sound waves that create detailed images of carotid arteries. It can detect plaque buildup and blood flow blockages. With a cerebral angiogram, a catheter is inserted and guided to the carotid or vertebral artery. A dye is injected to see detailed view of arteries in the brain and neck under X-ray imaging. With an echocardiogram, sound waves create detailed images of the heart. It may find a source of clots in the heart, which may have traveled to the brain. You may possibly have a transesophageal echocardiogram. This is where a flexible tube with a transducer is inserted in the esophagus, which is directly behind the heart, to obtain a clear, detailed image of the heart and any blood clots. An EKG can also be done to detect changes in waves. This can detect ischemia or possible causes of stroke. Here are some possible treatments for an ischemic stroke. You may be given aspirin to prevent new clots and prevent another stroke from happening. You may be given thrombolytic therapy, which is clot-busting drugs given through an IV in your arm, if you arrive at a hospital within a few hours of symptom onset and it is not contraindicated. Tissue plasminogen activator, or TPA, improves the chance of recovery. It may also possibly be injected directly into the brain. With mechanical clot removal, a tiny device is inserted in the brain through a catheter to break up or grab and remove the clot. With carotid endarterectomy, the surgeon removes the plaque from the carotid arteries. They may also use angioplasty and stents. A catheter is inserted into the artery, usually through the groin, up to the carotid arteries. A balloon is then used to open the narrowed artery, and a stent is inserted to keep the artery open. When treating hemorrhagic strokes, they must first find and control the cause of bleeding. You may be given medication or blood products. If you are on blood thinners or antiplatelets, you may be given these to counteract the effects. They will also stop any blood thinning or antiplatelet medications you're currently on. You may be given medications to decrease blood pressure, prevent vasospasms, or seizures. Intracranial bypass may be used to treat poor blood flow to regions of the brain. Endovascular procedures may treat certain hemorrhagic strokes. A catheter is inserted into a major artery up to the site of the weak spot or rupture. They then install a device to repair the damage or prevent bleeding. If your hemorrhagic stroke is caused by an aneurysm, they may use surgical clipping or coiling, also called endovascular embolization. With surgical clipping, a metal clip is put in place to stop the blood loss. With coiling, a catheter is inserted into the artery and guided to the brain. Detachable coils are then inserted to fill the aneurysm, to cause the blood to clot, and to block the blood flow. If your hemorrhagic stroke is caused by an arteriovenous malformation, or AVM, they may use surgical AVM removal or stereotactic radiosurgery. Surgical AVM removal may be used if the AVM is small and accessible to lower the risk of hemorrhagic stroke. The AVM cannot be removed if it is too large, too deep, or would cause large reduction in brain function. With stereotactic radiosurgery, beams of radiation are used to repair the vascular malformations. Here are some possible complications of stroke. It may lead to paralysis or weakness on one or both sides of the body. You may also have cognitive problems, such as trouble with thinking, awareness, attention, learning, judgment, and memory. It may lead to stroke-related dementia, also known as vascular dementia or vascular cognitive impairment. You may also have speech problems, including difficulty understanding or forming speech, as you may have less control over muscle movement in the mouth and throat. You may also have emotional changes, such as trouble controlling or expressing emotions. You can also have numbness or other strange sensations. You may also have pain, especially in the hands and feet, which worsen with movement and temperature changes. You can also have trouble eating, such as chewing and swallowing. It may lead to bladder and bowel control issues, seizures, depression, and even death. If you have a stroke on the right side of your brain, it affects the left side of your body. If you have a stroke on the left side of your brain, it affects the right side of your body. 1 in 4 survivors has another stroke within 5 years. There is also an increased risk of deep vein blood clots, also known as DVTs. Your doctor will work to treat any underlying cause of stroke. Be sure to take your medications as prescribed. You may be prescribed an antiplatelet drug or anticoagulant if your previous stroke was ischemic or TIA. You may be on other medications to control other risk factors. Maintain a healthy lifestyle, such as food, weight, activity, manage your stress, and don't smoke. Accept support from your friends, family, support groups, and counselors. This support will be emotional, physical, and psychological. They may have you follow up with rehabilitation. It helps you transition from the hospital to home. It can help you regain strength, recover brain function, and return to independent living. Speech therapy can help with producing or understanding words and with eating and drinking. Physical therapy can help you relearn movement and coordination skills. Occupational therapy can help improve daily activities such as eating, drinking, dressing, bathing, reading, and writing. The rest of your treatment team may include neurologist, physiatrist, nurse, dietitian, recreational therapist, social worker, caseworker, psychologist or psychiatrist, and the chaplain. Here are some ways to prevent stroke. Eat a healthy diet rich in fruits, vegetables, and fiber, and low in saturated fats, trans fat, cholesterol, and salt. Maintain a healthy weight. Be physically active. The Surgeon General recommends 2.5 hours of moderate intensity aerobic activity each week for adults. Children and teens should get 1 hour of physical activity each day. Don't smoke. Quit now if you've already started. Limit your alcohol intake. Should have no more than 2 drinks a day for men and no more than 1 drink a day for women. Prevent and treat other health conditions. Maintain healthy lifestyle changes and have routine follow-up appointments with your physician. Control your blood pressure. Have your cholesterol checked at least once every 5 years or more often if it is already high. Manage your diabetes and check blood sugars regularly. Manage heart disease and AFib. Be prepared for a stroke. You can keep medical alert identification available, including medical conditions, medications, and allergies. You can have a card in your wallet, you may wear a bracelet or necklace, and you can input the information on your cell phone emergency medical settings. The American Heart Association and American Stroke Association have a Fast Stroke app. It is a free download for Apple and Android devices. It gives information and valuable resources. This concludes the stroke presentation. If you have any questions or concerns, please follow up with your physician. Thank you.